I'm going to show you a method of how to do deep breathing exercises that will lower your blood pressure, lower your anxiety, especially when going to a doctor, and give you overall better health, mentally as well as physically. One of the problems is when you go to a doctor, it can be very nerve-wracking. And myself being a doctor, even when I go to a doctor, I'm flabbergasted by how rushed sometimes I feel when I go in. And I realize that, wow, people can really have what's called white coat syndrome, where you go into the doctor, they rush you in, they slap that blood pressure machine on, they push the button because nobody knows how to take blood pressure manually anymore. And the machine just, for some reason, just squeezes the daylights out of your arm and causes pain. Meanwhile, they're asking you, are you depressed? Do you want to hurt yourself? They're doing a depression screening, or they ask you some provocative question that makes you upset. And what do you know? Your blood pressure's up. Or maybe you find yourself just having a lot of chest tightness and anxiety, and you always feel nervous, and you're just not happy. I'm going to show you something that you can try, and I've showed many patients how to do this in my practice. It works quite well. So let's just dive into it and give you the nuts and bolts of how to do it. And at the end of the video, if you want to see how this can affect the tests, such as a blood pressure test, I'll leave a link at the end to show you how, just in a matter of minutes, you can normalize your blood pressure so it doesn't read artificially high for that particular moment. And then the doctor just wants to start medicating you and things like that. The first step is to sit or lie down in a comfortable place so that you're not stressed. Definitely put your phone to the side. You don't need it. However, you could set a timer, and I'll mention that in just a moment because of the timing. So what you're going to do first is you're going to inhale through the nose. Now, there's a reason for this. If you cannot inhale through the nose, then you cannot inhale through the nose. But most people can. And the benefit of this is there are sensors in our nasal passageways and our nasal cavities that when you do breathe in through the nose, your body will produce a gas inside the blood vessels called nitric oxide. And nitric oxide allows the blood vessels to relax and become more compliant and expand with each heartbeat. In other words, it helps our body lower its blood pressure. This is the true benefit of breathing in through the nose. So when you do breathe in through the nose, make sure and breathe as deeply as you possibly can. So when you inhale, you're trying to fill up your lungs as deeply as you can, almost like you're trying to inhale to maximize the oxygen consumption that you can get. Pretend that you're going to dive into a pool of water and you're going to try to stay underwater as much as you can. What would you do? You'd inhale really deeply. Now, when you let the air out, what you're going to do is you're going to let the air out of your mouth. This seems to be the most relaxing way to do it, because when you do it, you're going to act as if you're just letting the air out of a balloon, and it just kind of flows out naturally. At the same time, you'll kind of wiggle your shoulders a little bit as if you were a duck just getting water off its body. When you do it this way, it seems to be the most relaxing for people. It seems to be the most effective for anxiety and stress, which is exactly the culprit when it comes to white coat syndrome. And so it's very simple. It looks like this, and then I'll tell you how long to do it for. So here we go. Simple. Now, how many times do you do it, or how long do you do it for? The answer is you're going to do it for about 30 cycles. So 30 deep breaths is what you're looking for. That equates to, for most people, about 5 minutes. And this is where you could use your phone, set the timer for 5 minutes, but don't stress over the time. Don't be staring at the number. Put the phone down before you get started, hit the button, and then don't look at the phone again until the beeper goes off. The whole purpose of this is to relax. It's not to, breathe in, breathe out, breathe in, breathe out. So many people hyperventilate when you tell them to inhale and exhale. It's not necessary. Hyperventilation does not help you with relaxation. Relaxing breathing helps you with relaxation. And if you're concerned, ask your doctor if breathing is right for you. I mean, what is the doctor gonna say? Don't breathe? I don't want you inhaling through your nose. It's dangerous to blow out air out of your mouth. What is the doctor going to say? He's probably gonna look at you cross-eyed and go, knock yourself out, do whatever you need to do. So 5 minutes or 30 cycles is about the right amount. Now, how often should you do this? People ask, oh, what do you want me to do? Do this deep breathing all day? No, that isn't what we're saying. You could do it once a day. You could do it twice a day. The reason why we have such healthy teeth and terrible blood pressure is because we take care of our teeth twice a day, but we don't take care of our blood pressure until it's extremely high. And even then, we just want to mask it with medication. So if you did deep breathing exercises as often as you brushed your teeth, you'd probably have healthy teeth and you'd probably have pretty damn good blood pressure. So maybe try it once or twice a day. But in addition to that, you can also do it during times of stress. So this is where the doctor's appointment comes in. And you could do this before the doctor or the nurse or the assistant, whoever is doing the blood pressure. Let them know, hey, can I have 5 minutes where I relax before you check the blood pressure? And 99% of all doctor offices are going to be fine with that. You do the deep breathing, make sure you're seated or lying down, but make sure that your feet are flat on the floor, your arms are rested, you have a back support, you're in a relaxed position, and do the deep breathing before they check your blood pressure. You would be shocked when you find out that anxiety is a big culprit in the systolic number being extremely high for most people. And it's not something that needs to be medicated, it's something that needs to be dealt with naturally. And very often you'll find that many people have normal blood pressure, but they only have high blood pressure at the doctor's office when they're nervous. So if you're curious as to what kind of effect this can have on blood pressure within just a couple of minutes, then watch this video right here and you'd be surprised how effective this deep breathing can be.